Thank you very much for joining us today. Apologies for the technical issue on the last one, but we hope we'll have even more information to share today. And we are very grateful to be able to do this webinar with our co-organizer, also Global Health Council and IFRC, to be able to make this conversation happen just 1 week after the adoption of the political declaration on UHC. I'm Laura Philidor, the Advocacy and Communication Officer of the Civil Society Engagement Mechanism for UHC 2030, and I'm working also with YPLs. And I'm online today with my dear colleague Waiswa and Eliana to have a post-UHC HLM debrief and strategy session. Before we go over and we start the session, I will like to go over with you on some technical stuff. So the webinar today is being recorded, and we are pleased to offer simultaneous translation in English, Spanish, French, and international sign languages, as well as closed captioning. So all participants can select their preferred language directly by clicking on the little globe that you see at the bottom of your screen. You can select Spanish, French, and be careful to mute the original audio if you want to listen it in French or Spanish. Or if English is fine with you, you can just stay with the original audio and still hearing my voice. If you have any question, any technical issue, please feel free to drop a message in the chat box, and my colleague will help to support. Also, all along the session, we are welcoming any question. So please also feel free to drop any question regarding the content of the session in the Q&A, and we'll make some space during the webinar to answer to them. Last point on the technical issue, we have also closed captioning, only in English, but if it's not already on your screen, you can click directly on the little CCs at the bottom of your screen to make it appear. Great, now that it's done, I think we can start over the session, and I'm happy to present you the agenda of this today session. So we'll first go over some reflection on the 2023 political declaration, mainly on what are the major changes since 2019, what are the improvements, the weakness in there, and we'll go over more deeply into the political declaration itself, comparing it with the action agenda from the UHC movements and our 8 key areas. Are they really integrated? Are they mostly, partially not integrated? That's a question to which my colleague Waiswa will answer. Then in the second part, we'll have an overview of the key messages that have been given by member states on the floor during the plenary session of the high-level meeting on UHC. After this session, we'll open the mic and for some question, and we will take time to answer to your question for the Q&A. This is pretty dense, so if you have anything about what has been saying, this will be the moment for us to answer to that. And then we are holding an interactive session with you all. So you already know we had an in-person event in New York, and I see some of them that are rejoining today. So happy to see you here. And this time we want to hear more from you all, and we will share a link to answer and just to discuss on what's next in terms of our advocacy, civil society advocacy. Then Eliana will give a summary of what has been saying in New York, and we will close the session. Great. I think I will let the floor to my colleague Waiswa Ngongwa, the Senior Technical Advisor and Coordinator of CSEM, working with MSH. Waiswa, over to you.
Thanks, Laura, and thanks everybody for joining us this morning. My name, as Laura just mentioned, is Waiswa Ngongwa, and I'm the coordinator of the Civil Society Engagement Mechanism for UHC 2030. We wanted to have this, moment for us to reflect on what happened in New York last week, and also to share with you, to build on the conversations that we had as civil society after the HLM. We had a little gathering with civil society members in New York to try to, start to reflect on what what ended up being or realized in the political declaration, and then how we take this work forward. So for the next few minutes, I'm going to be talking about that, walking you through the political declaration, looking at it from both the standpoint of 2019, very briefly, and then mostly covering the analysis that we have done in terms of a comparison between the political declaration and the action agenda. Next slide, please. Next slide. Right. Yes. So this is this analysis we have done is very high level. You will see that it's a lot of it focused on the global areas, but not so much on the specific issue areas. So this is very, very, very high level. In terms of what we have seen as a change from 2019, one of them that is really notable is this very strong emphasis on PHC as a pathway for UHC, something that we did, in fact, push in the action agenda, as you will see later on. And we also saw a stronger language on financial protection and financing in general, more so than in the 2019 version, although, as you will see, there will be some caveats on the financing piece. We are seeing more emphasis on the health workforce and women's role. And as you will see later, it's something that we intentionally pushed for when we were developing the action agenda from the UHC movement. So that was very encouraging to see as well. There's emphasis on social participation. How do we make sure that people are involved, communities are involved, affected populations, vulnerable populations are involved in shaping UHC policies and also implementation and monitoring. And we see that language more reflected in this version than the 2019. There's a lot of commitments around digital health and patient safety. We have seen stronger links or new links made with pandemic preparedness and response as well, UHC and the connection between UHC and PPPR. There is, unfortunately, some areas that are weaker compared to 2019. For example, the issue of gender and SRHR which ended up being a very big part of the negotiation and the disagreement around that. We see that as a sort of like weakness in this political declaration. Next slide, please. So, as I said at the beginning, we tried to look at this, to do this quick analysis based on 2019, but that's the past, 2019. So we've since developed our own asks, the action agenda from the UHC movement. So, we've done even a more thorough analysis to look at what did we ask, the global ask that we put together for UHC this time, and how did those align with what's in the political declaration. So that's what this screen is basically showing you here. And it's a little bit subjective. And you also see that some of the things that maybe you work on or you care about are not necessarily addressed, but we're still calling, we're still ranking this as a success or not a success. in part because we are looking at it from the action agenda perspective. And so this is our attempt to try to map out how we would rank or how we would interpret what's in the political declaration. We see that there is the call for political leadership really was, when you read the document, you see it coming through. We asked in the action agenda for countries to prioritize, to take on UHC as a national priority. And we see some language that really tries to get to that. Leave no one behind. This is an area that we also had very strong emphasis on, and the document does talk about our vulnerable populations and key populations, but as you will see later, some challenges there. The enabling laws and regulations, strengthening the healthcare workforce and for quality healthcare, invest more, invest better, moving together towards universal health coverage, guaranteeing gender equality in health, connecting UHC and health security or PPPR. These were the 8 key asks that we asked this time around for world leaders to champion or to prioritize in the political declaration. And as you will see in the next slide, we've done some mapping here. Next slide, please. So here, what we are seeing here is, I will start with this, with the positive, and then I'll go to negative. Is that, there was alignment, broadly speaking, generally speaking, there was a very strong alignment between the action agenda and the political declaration. And you see this when it comes to the call for political leadership and national cooperation at the highest levels. These specifically languages different in multiple areas where this is being called out specifically on different issues. There's strong language. This is now action agenda number 2. There's strong language on ensuring access to services for vulnerable populations. As I said, and you can see a star there, and indicates that there's we'll talk about later how maybe this is not quite where people would have wanted to see it, or the way that we would have wanted to see it based on the action agenda. It's still on the action number 2 in the action agenda, emphasis on primary health care and community health is really, mentioned over and over in the document throughout, and we think that that was an area that was quite strong. On action number 3, on strengthening laws and regulatory frameworks. Again, we see those connections made in the political declaration, calling on world leaders to increase and sustain political leadership, strengthen legislative and regulatory frameworks, and also call for legal systems to strengthen digital health systems. On action number 4, which is on the health workforce, we see strong recognition of the role of women in healthcare workforce and the need to empower them, including promoting them in decision-making positions. We also see repeatedly language around the community healthcare workers and the need to improve training and development and recruitment and skills and equipment. These are all repeated throughout the document. So one of the strongest areas in the political declaration. But again, there's some, as you see later, there will be some gaps that we still see in there. Next slide. And then on action number 5, which is on more investment, better investment, there is clear language on financing for UHC, and it specifically mentions areas of R&D and digital health. The document has a 1%, of course, for 1% spending on PHC, and that's very consistent with 2019. However, as you will see later, spending on overall on health is not, there's no target there. And then on number 6, action number 6, which is on move together, meaning, you know, our social participation, accountability. We see, recognition of the importance of community health, community level services. And we also see some language around bringing our stakeholders together and around inclusive approaches to health governance for UHC and also social participation. But again, there's still some gaps in that language, as we'll talk about later. And then on action number 7, which is on gender equality, another area that's pretty strong in the political declaration, according to our analysis. It's very, the document is very clear about the role of women in healthcare. It calls for engagement of women growers in designing and implementing and monitoring of health policies and implementation. So it's quite, strong in that area. But again, there's a caveat on that because of the failure to address SRHR. And then there's strong recognition of the need to strengthen PHC and UHC for health emergencies, including the maintenance of essential health services during emergency situations. So that's also another area that we feel is mostly addressed in the political declaration, but again, more analysis is still being done, and maybe some people come to different conclusions. Now let's look at the other side of this document. Next slide. On the weaknesses. So, I'm sure you've all done your own analyses based on your issues you work on, and you have, different, if you see different gaps, and probably a lot more gaps than we have on the screen here. But there's a big weakness on spending. I mean, when we developed the action agenda, we called for 5% spending on health of GDP. And, we pushed this throughout the negotiation process. And unfortunately, we didn't get it. And so without it, really it's very difficult sometimes to go to decision makers and make the case that they are falling behind or they are doing well. So it's a disappointment that we don't have at least that baseline set in the document, but we will continue to advocate for the 5% or more. And then weak language on SRHR. This is very disappointing because if you look at 2019, you feel still it wasn't the strongest, but you feel like there was that strong recognition of women's rights as human rights and the call for women to have control and make decisions on things that affect them in accordance with the Beijing platform for action. And this time around, this became a very contentious issue along with other issues. And so it didn't make it into the document. Again, we must continue to push for countries to prioritize SRHR. And then, on the vulnerable and key populations, this document is interesting because you see it calling out some new groups that weren't in the 2019, but then some of the groups that were in 2019 or even not in 2019 are completely left out, like LGBTQA plus, and then sex workers, people in prison, and others are not mentioned at all in the document. I don't know how you write a document without that, but they did it. And then there is the language on accountability is not strong enough. And we would have wanted to see more commitment around establishing an accountability mechanism. The language on community healthcare workers and their role in the health system, it's one of the strongest areas, but it's also the area where it's not clear how they are integrated or will be integrated in the health systems themselves. And there are some other areas that are still weak, but in general, a very big improvement from 2019. Next slide, please. So, we wanted then to look at, what to share with you about what we heard in the from the countries themselves during the plenary, but also in some of the other spaces and during the HLM. And so, there were 16 heads of state in the UHC HLM. There was more in 2019, by the way. 10 of them spoke, and there were also 119 ministers, sorry, not ministers, ministers. And so, all things considered, we had 3 HLMs. We had the NSDG summit that same week. You don't expect heads of states to stay in a week in New York for 2 weeks. So all things considered, not terrible, but we would have wanted more. I think over 30 heads of states had registered for the UHC HLM, but only half of them showed up. So, a little disappointed, but still something great that they showed up to begin with. In terms of what they were saying in the during the HLM, we heard them actually over and over talk about the leave no one behind and the importance of prioritizing or focusing on key and vulnerable populations. And they were mentioning some of the populations that are not even the political declaration. So that was encouraging. LGBTQ, people in prison, sex workers, they were being mentioned by countries, even though they did not get mentioned in the political declaration. That's a good sign. That's a sign that we can, we have some level of support around this. And then obviously, as I said before, strong support for PHC. There was a lot of calls, including in the interactive sessions, in the panel sessions, a lot of talk about social participation, citizen engagement, to make sure that, the policies that are developed, the countries are developing, are responsive to the needs of communities, and then the role that civil society can play or should play in making that happen. There was talk about the limited physical space for health and the need to increase, think about innovative ways to increase resources for health. There was discussions about the need to align resources to countries' needs and plans. And some of you who have been following the conversation around the future of global health initiatives, there's a strong conversation around this issue. And so it also was repeated in during the plenary. And then the support for community engagement with a focus on the vulnerable populations. That was also repeated in the plenary. And there were many times that equity, digital health, gender, SRHR, which was left out in the political declaration, climate and health security were also said many times in the plenary. So that was encouraging sign, even if we didn't see these things in some of these things in the political declaration. I want to maybe stop there and see if there maybe you can have a few minutes, see if people have questions, and then we will dive into the interactive part of it. Laura, back to you.
Yes, thank you also for the presentation and this deep dive into the political declaration, the action agenda, and what has been achieved or not since 2019. Yes, I feel we'll have some time to answer to some questions. So I wanted to question in the Q&A that I will mention, but feel free to add your question directly in there. Or if you want to speak, just raise your hands and our colleague David and Pamela will go over and give you the permission to talk. First, I saw in the Q&A, so there was a question about how big the HLM was in terms of representation by Mawin. So yes, you can see that it was 16 head of states and 119 ministers, which is indeed less than in 2019, but as it is the second political declaration, it's already a good sign to see that they were in the room to re-engage on the previous commitments. So not a big win, but it's not a big loss either. And we have another question from Amrita Saka on just wondering if specific areas for LGBTQ community were addressed. So yes, sadly, as Waiswa mentioned, there is no mention of the LGBTQ in the political declaration, which is a huge gap. But fortunately, it was mentioned several times by member states on the floor, which means that didn't mean they commit to fill the gap, but it means that they actually recognize the gap, which is a good sign too. I know there was something addressed by the US representative, and I don't remember exactly the other one, but you can also go to the UHC 2030 Twitter to have an overview on the statement. We were able to retweet and tweet live and have most of the member states quotes in there. So that can be helpful to have a look on this. Great, I have another one from me, thank you. You did an interesting analysis of statement by intervening participants to HLM. Will bring additional interest is to see who was raising these points. Yes, as we can expect some different split polarization in position, especially a controversial topic. Yeah, that's a really good point. Indeed, it was very polarized in New York, so it was hard to get a consensus on some issue and some subjects. I think sexual and reproductive health is a good illustration of that. But I will maybe let my colleague Waiswa and Eliana to add anything on this question.
No, I don't have any specific information on, like which, group or member states were encouraging this or discouraging that, except obviously in the negotiation. During the negotiation, we knew who was opposed to what. There was that letter a few days, 2 days before the HLM from a number of countries. They were basically saying, we don't support the adoption of this document or these documents. It was all three, and also the SDW summit, because of something that they didn't like around coercive, coercive measures or something like that, unilateral measures. But in general, I'm not quite clear about the specifics of that. And by the way, something that I meant to talk about, we haven't even had time to share with you, that is really important as we're looking at this post-HLM conversation, is that the day before or 2 days before the HLM, the WHO and the World Bank released the global monitoring report for UHC, and it was terrible. I think there's no progress. Basically, we are moving backwards on that, and nearly half of the world's population not covered with basic services. And so, as we are looking at this document and thinking about how we go forward, we need to keep this in mind. That we have to double or even more than double our effort to get to where we should be later on to get to the targets we have by 2030. And so it's a very important time for us to have these serious conversations about how we go forward. Unfortunately, that information came out after the document had been written, so there wasn't much we could, much urgency we could push at that point to be reflected in the speaking, in the speeches or in the document itself, but it's very, not very encouraging sign there. Yeah, that's it from me. Back to you.
Great, thank you.
Is there a link to of UHC to PPPR? As I said before, yes, there is that link to PPPR very, very strongly. To TB, TB being a disease-specific issue per se, it is, addressed when we talk about, vulnerable populations, key populations, when we talk about regulations for new innovations and all of that. A lot of it is addressed in that context, but not specifically TB, not quite specifically addressed in the political declaration.
Great. Thank you for your question. Thank you, Royce, for the answer too. I think we should move on to the next one, but we will have some more space to answer questions. So feel free to keep put your question in the Q&A, and yeah, it's good to have your feedback too. So now is the time to our interactive session. We had an interactive session in New York with people who could be there for the session, which was amazing. We could organize breakout rooms and just, reflect together on how we can move forward in terms of civil society advocacy. And so now we want to hear more from you and have your feedback or to align with this plan and see how we can coordinate, especially as now that the political declaration has been adopted, our main mission will be to go back to countries to be sure it's being implemented. So here will be mostly the discussion we will have. And after my points, Eliana Monteforte will summarize also the key points that we had during New York. So first, I invite you to connect on the Mentimeter link. So it's basically a page when you will see like the question and be able to answer. And your answer will appear on the screen. So feel free to put your name at the end of your question or your organization, or to stay anonymous if you prefer. You can directly scan it here with your phone, but I will also put the link directly on the chat so you can access it more easily. Here it is. And as usual, if you face any issue into going to this document, you can share also your answer with us in the chat. And at the end of this interactive session, we'll have also 5 minutes to open the mic for any comments, any additional feedback that you may have not mentioned in the text. So let me share my screen so we all see the same thing. Great. Are you all well seeing it? Perfect. So let's start. So as a first step, just for a little warm up, to just have your opinion on things, even if I think, know how to answer this question with a particular focus. Let's go over your top priorities to drive progress on UHC. You will see there is 3, you can put different words, maybe in 1 or 2 words, what will be your priorities to drive progress on UHC. It can be very general, like increased financing or social participation, or it can also be linked to your specific areas. So yes, feel free, and then you'll see like a little cloud and we'll go over the conversation to that. Yes, strengthening PHC, primary healthcare, which is hopefully strong in this political declaration, which is a win for us. PhD again, SRHA, wow. Many words: financing, collaboration, research, CSO participation, Global Fund for UHC. Yes, this is an important one. Community engagements, yes. Monitoring, yes, there is a lot to do on monitor and have a measurable accountability mechanism that is not strong enough for us. Frontline workforce. What does everybody mean? Yes, what is behind UHC? Medical access. Wow, I'm impressed. I wasn't expecting so many different answers. This is very rich. Equity, training. A lot on self-care, financing, collaboration, which are the bigger words, which mean they are the ones who are the most written. Great, I think this gave us a good base to move forward more in-depth question. So I'm gonna switch slide and go over to the next one. For the next question. Yeah, we can see a big one on financing, collaboration, community engagements. You can keep answering to this, but I will go to the next slide to allow people who want to answer to this question to do so. Okay, so how will your organization enhance and sustain political momentum on UHC at the global country level? Again, yeah, feel free to directly write here. You will see your answer appearing, and to stay anonymous or to put the name of your organization. That will help us afterwards to collect and use these data, and we can discuss on that. Yes, direct country engagements. Strengthen primary healthcare services delivery and advocate for more investment and policy support for it. Advocate to the governments. Provide a space to unite civil society to collaborate and align advocacy. Engage with minister developments here in Germany to support UHC funding decision. Frontline workforce capacity building. That's great. I think I will let you all a few more minutes in silence to have time to give your answer. I see a lot also on multi-stakeholder engagements, like find availability for CEO to dialogue with government on UHC. Yes, a strong point, like to align together as civil society, but also to work directly with other sectors to be able that our priorities are being heard and that there is actually some action being taken. That's perfect. One more minute before I move to the other question, but again, you can take more time and answering. The more answer we get, the better it is to coordinate for the next step. Right. I see also some disease area specific active engagement of people living with NCDs. Perfect. Now it's time to move on to the next question. Thank you very much for your answer in this one. The next one is, how can your organization help translate global commitment to country-level advocacy and accountability for action? How can we better coordinate? The aim of this question is to see if you already have some plan within your organization on how you want to translate these commitments, and if no plan, if you have any idea from your organization what you could do or what you will do to translate these commitments. And then the second point is also like, based on this plan or these ideas, how do you think civil society can better coordinate, and how we can be useful also as the civil society engagement mechanism to help in that? And we begin strongly with no illusion. That's true. We have to be realistic in terms of what we can do and how we can push forward. Thank you. I see a lot of good comments again. Integrating UHC PNG agenda in our country and regional advocacy plan. Yeah, that's a strong one. Now that we have a global framework, thanks to the political declaration, how do we activate this in country and region? And yeah, we believe CSOs has a great role to play in that. Provide funds to CSO to organize the dialogue with governments and development partners and UHCs. A lot on data also. Use data-driven platform to provide evidence-based, strong case building. Yes, there is a strong demand on strengthening data, especially to identify people that are really left behind also, and make sure that this is monitored in every country and regional level. So that's a strong one that has also been mentioned a lot during the conversation in New York. Great. Okay, I think we had a lot of answers already. Thank you very much for this. I will leave that, but make sure to answer to this question very fast. We'll have a few more minutes to quickly see if you have any comments. If you want to give any comments, just raise your hand and we will give you the floor to speak.
I think there was a question by Marwin about accountability, which I would like to just respond to. I just responded to in the text there. So you're right that we're having this gap where countries are committing to things that they don't want to be held accountable, which is very, very typical. But we do have, just so everybody knows, that we do have some processes. The GMR, the Global Monitoring Report, is one of them, but that one does not involve civil society at all. And so I think that the other mechanism we have, or process we have, is the State of the UHC Commitments Review that is led by UHC 30 and it's done every year, and it brings in data from the VNR process, from other resources, peer review resources, from also civil society consultation that we do as CSM. And so we're going to continue to do that. And I think that the main question is going to be, how do we strengthen that data so that it really we capture as much as possible the gaps that are happening at the country level. And then it will be up to us to then take that data and take it to decision makers and show them what really is happening or not happening at the country level, and push them to take action. But yeah, there's a gap there in terms of the commitments themselves, but we will have to do it ourselves at this point. Thank you.
Thanks, Waiswa. I see one hand raised by Nombasa. We have a quick minute to allow you to speak. So please, Nombasa, take the floor.
Thank you so much, Laura, for this. I just want to have one quick question. As we rightly said that UHC principle is like leaving no one behind, but we are seeing a trend now in Africa of barbaric or draconic laws that are being passed, and those then hinder access to LGBTQI+ community in Africa. So how do we then work together or even push further to say UHC must really include everyone, including the LGBTQI+ community? So I just wanted to raise that one. Thank you.
Thank you, Nombasa. This is indeed a critical issue. I was pleased to be in the march for the LGBTQ movement and defense of rights at the UN HLM, and thank you, Nombasa, for organizing that. This is a critical point. It's not mentioned a lot on the political declaration, but it was raised by member states. I think there is a lot to do at the country level to raise this issue, but also in terms of data to make sure that this and the damage caused by the criminalization of laws, is really taken into account in our global state of commitment of UHC and every report we are based on. And I think there is a lot to do on this also at the country level. And I know a lot has been done in terms of making noise around that, and it's sadly not sufficiently heard by the global head of states. So yeah, this is a critical point to know how we can move forward in that. Yeah, I don't know if my colleague Waiswa has something to add on that and the importance on denunciating the criminalization of LGBTQ and other population.
No, this is where advocacy comes in. We can't let anybody get away with this, even if they did not write it down. Oh, I see Rosemary Mburu has a hand raised there, and maybe you should jump in and maybe also respond to this issue as well, if you have any thoughts.
Thanks, Waiswa. Thanks, Laura. I was actually wanting to comment on something else, but now that we are talking about issues around criminalization, leaving people behind, laws that are quite punitive, I think it's a moment for us at country level, regional level, global community to arise and challenge those. There isn't one formula to that. And I know communities and civil society here in the region are employing different tactics, but I think also it's not just a regional problem. So I think looking to us as a global community of advocates to arise, to challenge, to also stand in the gap, especially in countries where colleagues are being targeted. And we continue to do that. I mean, because you're spot on, like the U in the UHC basically means that everybody pretty much, we need to consider everyone. I wanted to speak to the point you mentioned, Waiswa, that even though there is a commitment around primary health care of 1%, there wasn't a mention of a health financing target in terms of health budgets. And I wonder then whether it's a moment for us to look at some of the regional commitments that exist already. So if you look at the Africa region, member states have committed to some health financing targets. And I think we could use those for accountability. So the African Leadership Meeting on Investing in Health has a number of indicators. So I think in areas where we don't have targets, I think we need to push around either the national targets or the regional targets that exist and that our member states already have committed to. So just wanted to flag that. And there wasn't, I think, much or strong language around domestic resource investments. I think that's also very important in terms of sustainability, but from a global solidarity point of view. I think we are not saying that external funding and ODA doesn't have a role, but I think there is need for stronger domestic leadership on this in terms of investment.
Thanks, Rosemary. Eliana?
Yes, thank you, Rosemary, for this intervention. Thanks, Faisal. And yes, now the time is running out for any other answering question, but please feel free also to put your question in the chat. And yeah, we hand over to Eliana Monteforte, Director of Special Project at the Global Health Council, which is also co-organizing this session and member of the steering committee of the advisory group of CSEM. Eliana, welcome.
Thank you. I actually just wanted to make a comment on the question about the LGBTQI community and just, what do you do if at the country level they're really being left out? And I just wanted to say this is why it's so important for platforms like CSEM or even Global Health Council or these network organizations to find spaces for people within the LGBTQI community to speak at a lot of these global level events and to be able to give them a place where they can be heard, because sometimes it's really hard internally to influence your government, especially when your government is criminalizing, other, certain people, especially using laws to criminalize other people. And so really making noise within the international community and giving space to people from this community, I think is really, really important. And I think that's something that we're really trying to do as CSEM. So I just wanted to say that part of our work is critical. I think, Laura, you wanted me to come in and talk a little bit about what some of the other civil society what some of our other civil society colleagues said during our civil society strategy session, which actually happened on the last day of the week of UNGA. So it was a really great session. We had, I think over 70 civil society colleagues that joined, and we gave them very similar questions to what you were given today. And it was really nice for me to see that there are a lot of similar responses. The first key priority for the civil society that attended our strategy session was, of course, this question of investing in UHC, and the fact that we don't have a political declaration that has an investment target is a red flag, I think, for most advocates, and that we really need to push governments to be a lot more concrete in terms of the type of funding commitments that they're going to be pushing at the country level and implementing at the country level. So that, of course, was first and foremost, I think, mentioned in the session. Strengthening civil society role in social participation. So this is actually something that we discussed a lot in the in-person meeting. There was a lot of civil society that recognized how important it is for civil society to be part of developing the health system, designing the health system, monitoring, evaluating. And one of the best ways to institutionalize civil society participation in that is through social participation. And social participation is a method that, well, there are many methods of how you can do social participation, but it's basically when governments bring together multiple stakeholders, civil society being a key one, to either discuss policy or, to design health systems, things like that. And this is something that UHC 2030 is really pushing. Some of you may know that there is a handbook on social participation that civil society within CSEM actually participated in the development of this handbook. And it provides governments with ways, reasons, case studies on why to do this. So institutionalizing social participation is something that's really important to the UHC 2030 movement, but also was really important and discussed in the in-person meeting with our civil society colleagues. Pushing policies to improve working environments for community health workers. I think in general, the topic of health workers came up a lot, even though the text around health workers in the political declaration was really strong. There are still some missing pieces there that we need to push, particularly with incorporating community health workers into the overall health system, making sure that they too are considered, health and care workers, are receiving the training and the compensation that they need. Oftentimes they're not really considered health and care workers, and not fully integrated into the health system. So really pushing for that came up quite a bit. Strengthening health data to identify groups left behind. There was a lot of talk about how we need disaggregated data to understand who specifically is being left behind, what population groups, but also why, what's happening that's leaving them behind. And Waiswa mentioned the global monitoring report, and Laura, I believe, put the link to our civil society commentary on that report. And one of the main points that we made in our commentary was that the report has no disaggregated data. So it's really hard for us to see at a global level which population groups are being left behind. So in the strategy session, we talked a lot about pushing for that kind of data to identify those groups and to make sure that governments are addressing their needs. Tackling cross-cutting issues. I mean, we know that health impacts so many other sectors. So making sure that we're not just talking to ministers of health, but ministers from other sectors that might be impacted or are impacted by UHC and UHC policy, and then engaging with decision makers. So and this is something that I saw come up a lot today in the Mentimeter exercise, how important it is to bring together civil society and governments so that they're talking to each other. And again, I think this is where social participation and institutionalizing social participation can be a good way to achieve that. I know we're running out of time, so I'll stop here and hand it back to Laura.
Oh, thank you very much, Elena. This is really helpful to have a summary of actually what have been said in New York, but also a summary of the answer during the Mentimeter and the iterative session now. So yes, unfortunately, we're running a bit out of time. So I'm moving on to displaying the next step and closing the session smoothly. Thank you very much all for your participation in this session and to join us on a Friday after this busy week on the link to UNGA, but also a lot of other health events. So thank you. To move forwards, we encourage you to share your national and regional campaign following the high-level meeting. You can send us an email with some of your ideas, your analysis of the political declaration, or any also official document that you want us to promote. We're very happy in sharing knowledge in this. You can also join us for the virtual launch of the Global UHC Day campaign, which will be on October 18. This year, the theme is Health for All's Time for Action. And this will be the occasion to reflect also on the political declaration and see how we can move forwards together. So please don't miss it. It will be a huge one, and we're looking forward to see you for this next step. You will have also the opportunity to engage in the global conversation at the World Health Summits, which will be between October 15 and 17. The good thing about that is even if you can't be in Berlin, there will be a virtual participation and free virtual participation available. So yes. And finally, for CSEM, stay tuned for opportunities to participate in the next state of the UHC commitment review. This will be a major occasion and opportunity to raise some data from the countries. And I think we need that, and we need to emphasize on what's actually happening in the country to make sure to leave no one behind. Thank you very much. If you want to be kept informed on our latest information, please join us and become a CSEM member, and you will receive all this information by email. You can scan it with the QR code or register via the link here. I think I'm going to close the session now, except if my colleague has something to say. But overall, thank you very much, everyone, for coming, and we keep in touch for the next step.
Thank you, everyone. So I will get a chance to answer all your questions, but we're going to continue to have these conversations, to organize these webinars so that people get, up to date on what everything is, what we're planning to do and how we can move together going forward. Thank you again, and we'll be in touch soon.
Thank you. Bye.